So today I am going to discuss about sulfonamides. So it belongs to one antimicrobial agent. So these are the drugs act by inhibiting metabolism. Sulfonamides were the first antimicrobial agents which was effective against pyogenic bacterial infections. Pyogenic bacterial infections means which is against pustular infections. So here what we have to notice, the dye, that is pronostil. This was once used as a dye by Dormack, which was a scientist, which is a German scientist, and he used it in experimental streptococcal infection in mice, and it was found to be highly effective. Subsequently, an infant was cured of staphylococcal septicemia, which was 100% fatal at that time, and it was cured by pronostil. So later what was noted was, by 1937, it became clear that pronostil was broken down in the body to release sulfanilamide, which was the active antibacterial agent. So here what you can see is folic acid metabolism. Here is a normal how folic acid synthesis happens. So these are the three factors, that is pyridine, PABA and glutamate. So in which PABA plays a major role. So here you can see PABA get converted into folic acid, which is an inactive form. It is also known as dihydrofolic acid with the help of folic acid synthase enzyme. So what happens here is, from this dihydrofolic acid, it will again get converted into tetrahydrofolic acid. It is also known as folinic acid, which is the active form. Then it helps in the formation of DNA. So this is a normal folic acid synthesis. So here again coming to the folic acid synthase inhibitors. So here we are discussing about the drugs, especially sulfonamides. So if given alone, it is bacteriostatic activity. Bacteriostatic means it will prevent the growth of bacteria. So here dihydrofolic acid reductase enzyme inhibitor, we have seen the enzyme which is responsible for folic acid synthesis. So these are the drugs, that is trimethoprim and pyrimethamine, which inhibits dihydrofolic acid reductase enzyme. So if it is given alone, again it is bacteriostatic. So what we have to do? So we have to combine both drugs. So before we have discussed like normal folic acid synthesis. So coming to bacterial folate metabolism. So here what happens is, so according to the property of these drugs, how these drugs act. So you can see here sequential blockade in bacterial folate metabolism. Here you can see PABA, that is para-aminobenzoic acid. So sulfonamide inhibits this folate synthase enzyme, which helps in the conversion of DHFA. Here trimethoprim will inhibit dihydrofolate reductase enzyme, which helps in the conversion of THFA. So combination of two is bactericidal. Before we have discussed like the individually, if we give it, only gives bacteriostatic activity. Bacteriostatic activity because means it prevents the growth of organism. So these are the drugs, that is sulfadoxine, sulfacysteine, sulfazoxazole, sulfamethoxazole and sulfasalazine, sulfadiazine. So these are the drugs which are also known as sulfa group of drugs, that is dapsone, and these comes under the group of sulfones. Then tolbutamide, which is sulfonyl urease. This dapsone is used in the treatment of leprosy, and tolbutamide, it is used in the treatment of type 2 diabetes mellitus. So what happens to PABA? Sulfonamides are structural analogues of PABA, that is para-aminobenzoic acid. So chemical structure is similar to PABA, and it is a competitive inhibitor of folic acid synthase enzyme. So what happens here is sulfonamides get incorporated. So we know sulfonamides are given for pyogenic infections. Here you can see the infections in the presence of pus. So this pus contains lot of PABA. So what happens when sulfonamides are given in the presence of pus? Like due to this reason, sulfonamides are less effective in the presence of pus because it contains lot of PABA. It is a structural analog of PABA. So adverse effects. Sulfonamides, also known as sulfa drugs, potential to cause drug allergy. It is altogether known as sulfa drug, and we can call it as sulfa drug allergy also. Then these are the adverse effects which is caused by sulfonamides, that is aplastic anemia, bilirubin displacement, crystalluria can cause rash, metabolized by acetylation, can cause SLE and can cause hemolysis. So aplastic anemia include anemia, leukopenia, thrombocytopenia. Then bilirubin displacement. So what happens in bilirubin displacement? It can displace bilirubin from plasma protein binding site, PPB, plasma protein binding site. So bilirubin binds to albumin, cannot cross blood-brain barrier. So what happens? When sulfonamides binds to albumin, the bilirubin becomes free. It displaces bilirubin from binding site. This free bilirubin cannot cross blood-brain barrier. So what happens in the absence of blood-brain barrier? In case of newborn babies, it will displace bilirubin and can enter the brain and can get deposited in basal ganglia and can cause kernicterus. So you can see the picture of a baby having kernicterus. This is due to bilirubin displacement. So in newborns, it is not allowed to give sulfonamides. Then it causes crystalluria. So sulfonamides are insoluble in acidic urine. They get precipitated in the renal tubules, can lead to renal obstruction and finally renal failure. Patients are instructed to take large amount of water during the treatment. So sulfonamides can cause rash, skin rashes. So SJS is Stevens-Johnson's syndrome. So it is a hypersensitivity reaction. Usually this reaction can be seen by sulfa drugs. So this you can see the skin infections, the rash due to sulfonamides. Then it is metabolized by acetylation. It can cause SLE. Some antibiotics, you know SLE is an autoimmune condition, but some antibiotic can precipitate SLE, such as sulfa drugs especially. Can cause hemolysis in patients with G6PD deficiency. So other sulfonamides are sulfazoxazole. So it is a newer drug and it can only cause minimal crystalluria. So the side effects are lesser for newer drugs. Then sulfasalazine, it is a prodrug used for ulcerative colitis, also used in rheumatoid arthritis as a disease modifying anti-rheumatoid drug. So this is ulcerative colitis in which sulfasalazine is used. Then sulfonamides, these are the sulfonamides which is mainly used for topical application, especially burn dressing. So the drug is silver sulfadiazine. So topically ointments are used. Then as I have told, these also belongs to sulfa group of drugs. So sulfones, that is mainly used for leprosy. The drug is dapsone and it is also used in dermatitis herpetiformis. So you can see the difference, the patient with leprosy, and he was later on treated with dapsone, and the condition of the patient in the second photograph. So dermatitis herpetiformis, in this condition also we can give dapsone, which is once more a sulfa drug, sulfone group of drugs. Then according to the action, duration of action, you can classify sulfonamides as short acting, intermediate acting and long acting. So what are short acting drugs? It acts around 4 to 8 hours. So that is sulfadiazine, and intermediate acting, that is 8 to 12 hours, sulfamethoxazole. Then long acting, approximately 7 days, sulfadoxine, sulfamethopyrazine. Then other drugs, special purposes, as we have discussed before, sulfadiazine and all those topical applying ointments, sulfasalazine for ulcerative colitis, this for burn dressing and all, we use silver sulfadiazine. So combination. So as we have discussed before, individually if these drugs are given, it results in sequential blockade and it gives only bacteriostatic effect. So if at all, what happens if we give these drugs in combination? So these are the combination drugs, that is trimethoprim and sulfamethoxazole. So trimethoprim is 80 mg, sulfamethoxazole is 400 mg. So when it is combined together, it has a bactericidal activity. So cotrimoxazole, it is a combination, it is also known as FDC, that is fixed dose combination. So when these two drugs are combined, we have bactericidal activity. So it is available in tablet form, usually 480 mg. So you can see the combination trimethoprim contains 80 mg and sulfamethoxazole, it contains 400 mg. So it is usually in 1:5 ratio and it is available in tablet form. So as we have discussed before, individual effect only gives bacteriostatic activity. When it is combined, we will get bactericidal activity. So these are the images. So it is a drug of choice in Pneumocystis jirovecii and drug of choice in Nocardia. So these organism will cause pneumonia in patients, especially not in healthy individuals, usually in immunocompromised patients. So these are the drug of choice. So cotrimoxazole, which is FTZ, it is given usually in Pneumocystis jirovecii and Nocardia. So these are the drugs, brand names. Then sulfadoxine and pyrimethamine. These combinations are usually used for parasitic infections such as malaria and toxoplasma. Parasitic infections. So these combination, that is sulfadoxine and pyrimethamine. So coming to uses. So these are the general uses of sulfonamides, that is urinary tract infection, respiratory tract infection, bacterial diarrheas and dysentery, as we have mentioned before, Pneumocystis jirovecii, chancroid, which is a sexually transmitted disease, and typhoid. These are the general uses of sulfonamides. Then coming to adverse effects, coming to the adverse effects of sulfonamides, all adverse effects seen with sulfonamides can be produced by cotrimoxazole. Cotrimoxazole, we know it is a combination, fixed dose combination, that is trimethoprim and sulfamethoxazole. So the other side effects include nausea, vomiting, stomatitis, headache and rashes. So folate deficiency, megaloblastic anemia is infrequent, occurs only in patients with marginal folate levels. So, blood dyskaryosis occurs rarely. The slide regarding resistance to sulfonamides. So, it is due to produce increased amounts of PABA, as we have discussed before. If it contains lot of pustules or pus containing infections, then it can produce lot of PABA. So, this also can be a reason for the resistance. Then their folate synthase enzyme has low affinity for sulfonamides. Then adopt an alternative pathway in folate metabolism. So, here we are coming to the end of the slide.